Good morning, ladies and gentlemen. It is an honor for me to be here with you today. I would like to thank the organizers of this important event, World Pediatric Congress, for the invitation, and I would like to welcome you all to this lecture about breastfeeding during the COVID-19 times. This lecture is the result of this consensus and can be found in our national magazine of pediatrician, Archivos Venezolanos de Puericultura y Pediatría. There is a permanent follow-up of this issue. This important issue was recently discussed at the 19th Congress of the National Academy of Medicine of Venezuela, my country. International health organizations such as WHO, UNICEF, recommended mothers who have tested positive and patients under investigation should continue breastfeeding under strict security measures. Mothers must wash their hands very carefully, and they are requested to wear a mask at all times. They also recommended mothers with mild or severe symptoms who require special care. Milk extraction should be carried on with the security measures and should be given by the baby by a healthy person using teaspoon, small cups, syringa, or anything but a bottle. All international healthcare organizations agree that breastfeeding is the ideal way to feed a baby from birth up to 6 months old exclusively, and up to 2 years old or more as a complementary food. The promotion of breastfeeding substitutes affects neuroendocrine development, therefore might increase the child risk suffering from recurrent infections, malnutrition, and even death. Recent research has shown that the milk from mothers who have suffered from COVID-19 contains SARS-CoV-2 antibodies, and it does not contain viral RNA. The milk from mothers who have been vaccinated has SARS-CoV-2 antibodies. The milk from mothers who have had COVID-19 and were vaccinated has an even greater quantity of SARS-CoV-2 antibodies. It has been found that COVID-19 is not transmitted by human milk, but it can be transmitted from the mother if she fails to take the necessary protection measures, since it is a respiratory virus. WHO recommendations are to maintain food security. Breastfeeding is becoming increasingly important because it's the ideal food for infants and young children in emergency. It is proof that low mother and child transmission. Our best advice for mothers is promote, protect, and maintain exclusive breastfeeding during the first 6 months and complementary food up to 2 years or more. Breastfeeding support programs, according to WHO guidelines, mothers must be educated. There must be prenatal consultation, telehealth, and family must be educated in order to protect, promotion, and support breastfeeding. The protection during clinical performance. In newborn without complication at the hospital, You have to respect the maternal desire about type of delivery, vaginal or cesarean section. And you have to do a late clamping of the umbilical cord from 1 to 3 minutes. And also, you have to practice skin-to-skin contact in the first hour life without any interruption in order to start the lactation. And you have to allow joint hosting. WHO guidelines in newborns of COVID-19 mothers suggest joint accommodation in a symptomatic mother or with suspect infection or confirmed. The conditions are caught at 2 meters, room not shared, and a healthy adult to take care of a baby. You have to take biosecurity measures, hand washing 20 seconds before or after touching the baby or handling the extraction equipment. Wear clean gown only for this purpose during the breastfeeding, and correct use of a mask over a mouth covering. Do not speak during breastfeeding, and in case of coughing or sneezing, change the mouth cover and wash your hands. In case of temporary separation, biosecurity and hygiene measures such as start manual extraction as soon as possible, like baby suction, use breast pump, a healthy caregiver should offer colostrum or human milk, which is a spoon, syringa, or cup. And you have to consider whether the benefits of separation outweigh the risk of contaminating the child. Inform the mother and the family to take the best decision. Recommendation at home. The mother with COVID-19 should be separated from her baby, should be guided by expert in breastfeeding. Start breastfeeding as soon as possible, maintaining biosecurity measures, joint accommodation with a cot at 2 meters from the bed, depending on maternal conditions, and healthy adult to handle the baby. Legal framework for the protection of breastfeeding through the International Code of Commercialization of the Milk Substitutes. The legal framework of breastfeeding protections guarantee safe nutrition for the infant, maximum food safety, child survived, and it's free and 100% ecological. Recommended by the International Code of Commercialization of Milk Substitutes. The use of substitute of human milk in breastfeeding when it is not possible due to maternal or child causes. It is the alternative in safe feeding to infant. Substitute of human milk should be available when needed, but not be promoted. It is not imposed breastfeeding. It protects from unethical commercial practices. The objectives are to curb aggressive marketing of substitutes of human milk. In pandemic, substitutes of human milk aid could be dangerous because mother stopped breastfeeding and then she doesn't start it again. The use of substitute of human milk increase, and we have to promote relactation. Ensure feeding to non-breastfed children. We have to consider the age of the child. We have to guarantee access to appropriate substitute of human milk until the restoration of breastfeeding to direct suction. And we have to evaluate, stimulate and support the possibility of breastfeeding again. We have to ensure the feeding of hospitalized children with colostrum using pasteurized human milk from banks of human milk. And we have to prioritize the use of for low-weight newborns, preterm newborns, and sick newborns. Monitor the use of substitutes of human milk in emergency with COVID-19, where there is no breastfeeding or no pasteurized human milk. The use of substitute of human milk in children under 6 months will be indicated. The use of substitutes of human milk in children older than 6 months will depend on existing resource. In case of temporary indication, reluctance period, temporary separation of the child from the mother when banks of human milk is not available. In case of long-term indication, infants not breastfed before the pandemics, mothers who do not wish to breastfeed or relax, infant with HIV mother, orphan infants, infants with a mother absent for a long time, a specific medical condition of the infant or a mother in case of isolation of the population. In case of complementary feeding from 6 months to 2 years, there is a diet balance, biosecurity standards before, during, and after the preparation of substitute of human milk, limit the number of persons responsible for feeding the child, and utensils for individual use, such as plate, glasses, cups, and spoons. In case the caregiver or child has respiratory symptoms, they have to go to the nearest health center. They must wash hands and use of alcohol or gel before preparing and eating food. Surface where you can prepare food should have been cleaned with water and soap. Wear mask permanently and choose fresh, good-looking food and keep them clean safely. After preparing them, serve them immediately. Complementary feeding from 6 months to 2 years, you have to give soft food 2 or 3 times a day. Chopped fruits, do not use juice. Cereals, tubers, vegetables except beets, chard, turnip, and spinach. White and red meat, well crushed, round, shredded, chopped until progressively solid 2 or 3 times a day, 2 or 3 tablespoons per meal. Increase gradually portions until reach a cup at 2 years. Allow the use of the clamp to take their food. Do not supply cow's milk to children under 24 months. Introduce dairy products like cheese, yogurt, and butter. Keep the children hydrated with drinking water as an indispensable nutrient in a cup. Offer food at every meal, even if it shows no sign of hunger. Make sure 3 meals and 2 snacks. In all cases, maintain intakes of human milk. There are no strict patterns regarding which food to administer. Offer only a new food at a time, every 2 or 3 days. Do not delay the introduction of potentially allergic food such as eggs, fish, citrus, and wheat. Do not use salt, sugar, honey, or sweeteners at all. valid for healthy, positive, asymptomatic infant patients with mild or moderate symptomatology with oral tolerance. There is no justification for delaying the introduction of food at 6 months, even in the presence of illness. It must be kept with a child hospitalized and stable. You have to guarantee optimal caloric nutritional contribution. When leaving the hospital, you must keep the complementary feeding at home. You have to consider they continue in service with the preventive measures. Human milk bank health worker should use personal preventive equipment to avoid contagion. Decrease the number of donors simultaneously from milk donation. At the end of the donation, clean the share used with 70% alcohol. To the mother who donates, ask if the previous 15 days had direct contact with symptomatic or patient under investigation or people confirmed with the COVID-19. And you must take donor temperature and guarantee that is normal. For collection and reception of human milk, you have to guarantee extraction kit and PPE for donors. Select mothers before donated. Do PCR for COVID-19 to mothers who develop symptoms. Only if it is negative, she can donate. The symptomatic or confirmed mother should continue to extract milk to avoid mastitis. Human milk bank personnel must comply with the procedures for transporting the extracted human milk. All donated milk must be subjected to a pasteurization folder of 62.5 degrees for 30 minutes. Rigorous cleaning of the extractor pumps must be done. The human milk is for the most vulnerable newborns, low weight, preterm, high risk, who cannot be breastfed directly from their mother's breast due to the child's difficulties, or also maternal conditions such as HIV positive or drug use. Care of the mother during the donation of milk. Mother must wash her hands before touching the baby, before and after touching the breast pump and expressing milk. Mother must wear mask. Do not speak during breastfeeding. The mask should be replaced in case of cough, sneeze, or in each new intake. In the milk extraction room, comply with human milk bank guidelines and maintain a distance of 2 meters between mothers. In the area of individualized counseling or telehealth. Recommendations for the breastfeeding room. The extraction in the breastfeeding room is not recommended in case of suspicious mother or confirmed by COVID-19 infection. Mother confirmed with COVID-19 must follow WHO guidelines while feeding her child. Wash her hands before touching the instruments for the human milk extraction and the container where she will place it. The human milk extracted, if not used immediately, should be in a very clean glass, closed and refrigerated to 4 degrees. Recommendations for the breastfeeding room. Clean the breast pump after each use. Human milk can be given to a baby by a healthy adult. The human milk extracted from a positive COVID-19 mother must be used within 24 hours or discouraged. Thank you very much for listening to my talk today. I would like to again thank the organizers for this important World Pediatric Congress for the invitation to present today, and welcome any question you may have.